Alright, so I get a little tired of seeing some of these articles, right? We're just gonna go right to it. Ohio reports record number of new COVID-19 cases. Ohio National Guard prepares to help hospitals. Alright, so already in the headlines, we're getting the idea that things are out of control and we need some type of assistance. Alright, so here we go. Ohio reported 12,502 new COVID-19 cases on Tuesday, marking the highest daily number since the beginning of the pandemic. Ohio also reported a high positivity rate of 18.8% over the past 7 days, meaning that nearly 1 in every 5 people tested is getting positive results. That's more than twice the positivity rate reported 2 months ago. And they want to sell you these numbers, right? Because they're trying to make it look like this terrible fucking thing that's happening. And it's funny because if the detection rate is going up, then that means people are becoming more familiar with the symptoms and we're actually getting better at detecting the people that would likely have it versus just everybody going getting tested every single time they're sick. So, you can chalk that up to a net positive in my book, that people are getting tested that actually need to get tested and the results are coming back more positive. Now let's look at that number, that 12,000 new cases. I do believe that is a peak. That is a fact for Ohio. But we're going to continue reading and find out why that is. Ohio Department of Health didn't immediately respond to the questions about why the number was so high Tuesday. We actually do know. The highly contagious Omicron variant was first detected in Ohio earlier this month. Cold weather has forced more Ohioans indoors. Ohio's vaccination rate is among the lowest in the nation, with only 54.6% of residents fully vaccinated. That includes boosters and two-stage shots and everything like that. Now, the important thing to pull out from this is that they specifically mentioned the Omicron variant. We've had multiple different variants. The original, the Delta, Omicron. These are the ones that mostly make the mainstream. There have been others. But notice how they specifically mention the Omicron variant. And the interesting thing about the Omicron variant is that it is the most pervasive. It is the most contagious. It's the easiest to spread amongst other people and easiest to contract. And so with that, you get a variation of the virus. That's also uniquely one of the easiest to treat and not have symptoms for. So they can detect it, but you're more asymptomatic than with any other variant. And you also, along with that asymptomatic status, you get less deaths. So they're actually talking about here that the cases have spiked. They're aware of the new Omicron variant, which spreads rapidly, right? And it's specifically because the number of people infected are going up that the situation's worsened. Well, if they're getting infected with the Omicron variant, which is asymptomatic for most people and does not have lethal symptoms for most, that means that people are able to get this disease ingested into their bodies and not develop the deadly situations of the Delta and the original variant. So if more people are being exposed to this and we're contracting it at a larger rate, we are building a natural immunity at the largest and safest rate possible since the pandemic has started. They won't say that because they're only focused on the number of people that have actually contracted it, and oh, more people is bad. But the number of people that actually, where is it? I had an article here. But the point is that it's far less lethal and more contagious, and so the more people that get it, the more natural immunity they'll have to the other variants that are more of a problem for people. You see what I'm saying? So they're instantly touting this as like a de facto negative trait of the fact that these numbers have gone up. They didn't respond to questions. Okay, the highly contagious Omicron variant was the first detected in Ohio earlier this month. The cold weather is forced. Okay, yeah, everybody's staying inside, so I'm not sure how it's spreading. Big numbers comes as the Ohio Department of Health, Ohio Hospital Association, and Ohio National Guard work to determine where to send 1,050 Guard members to help ease hospital staff shortages. And you know, that was the headline of the article. Okay. They got to deploy the National Guard. It's that serious, right? It's this huge fucking problem where we just can't keep up, okay? I want to show you something. It's just in Ohio, we have 31.3 million served. 25 and a half of that is outpatient, so they're here and gone. We got 1.4 inpatient, and we got ER treated, which is immediate but non-life threatening usually type of stuff. Inpatient is usually where we're at. So we have 1.4 million people, probably a lot of them for COVID. Employed in our healthcare system in just Ohio, we have 251,000. Not all of them are medical professionals, I'll give them that. They're just employed in the system. We have 251,000 employees in that system. Now, let's be generous, scratch off some custodians, some office workers, people that never have to, pick up a needle or be a nurse or do any type of diagnosis, just paperwork. So we'll run it down to 200,000, right? Okay. What are you going to do with 1,000 extra abled bodies? Like, they really want to sell. That's like the whole headline of the article. But what are you really going to do with 1,000 extra bodies, less than 1% more, to ease the trouble that these understaffed hospitals are having? Like, I don't get it. Like, ah. Guard members are expected to start in Ohio hospitals as early as Thursday. Harris anticipated most members will be sent to the Cleveland, Akron, and Canton areas that experience a perfect storm. So they're literally admitting that it's a high burst rate. It's not necessarily a high amount, but these particular affected areas where they're getting lots of people, they need to send extra support. So I don't actually have the numbers for what places like Cleveland Clinic, Akron Children's, or anything in Canton, Mercy, Altman have on record for how many people that they actually staff that are practitioners, but 1,000 people aren't really going to shift that number too much. I mean, I'm sure any relief is enough relief for our medical teams right now, but it'll be shifted to locations as demands change. So they're not digging in. They're basically here and gone. So they're going to be doing very minor tasks, nothing that they can get invested in. Some Ohio hospitals have postponed elective surgeries during the latest COVID case surge. Okay, I can't stand this stuff. If it's an elective surgery, it means you're opting into it. It's not a life-threatening or immediate surgery that needs to happen. So because the hospital is overstaffed and overwhelmed at this moment, you can't, or some of them have not canceled, but just slightly postponed elective, optional, like the peak of your healthcare surgeries because a few people got COVID. It's like they're really trying to sell this to you, right? Like how awful everything is, but then like when they actually explain it, everything is counterintuitive to what they're actually trying to sell you. Guard members are receiving training as well as a booster shots in preparation for entering Ohio hospitals. Fine. Service members. Get them the boosters. Harris reported that 92% of Ohio's National Air Guard members are fully vaccinated, but just 52 to 53% of Ohio National Guard soldiers are. The Federal Department of Defense mandated that Army soldiers get vaccinated by June 2022, but Harris said he met March 20th as the deadline for Ohio National Guard members. Yeah, those guys that, okay. There's been a lot of debate, and I know that you've seen governors have pushed back the DoD mandate to get our National Guard vaccinated, Harris said. But the reality is that it's simpler for me. Why would you say that? We have to deliver on national security obligations. In order to do that, we have to get our forces vaccinated. That's a fair argument, but then when you dress it like that statement alone is a completely fair argument. When you dress it with, it's a benefit for me because I don't gotta fucking worry about it anymore, and it might save you some planning about who's more appropriate to go to a certain area. And we're only talking 1,000 men. You're overwhelmed with the planning of 1,000 fucking men. What? What are you doing in this position if that's your... Oh my. Oh my, oh my. Guard members are already on deployment on multiple missions, including helping administrate booster shots for the Ohio Department of Aging and assisting southwestern states with border control. Department of Aging. I don't like the sound of that. That's the end of it. Woo! Oh, man. What? I mean, man. There's already people in the comment sections, right? They're like, oh, it's the unvaccinated. They're killing everybody. Honestly, like, I don't even know if there is any legitimate death numbers on the Omicron variant. Like, it's just easier to contract. It has less symptoms, less severe symptoms. And just by having it and contracting it, you build an immunity to the other ones because it's already a variant. So even if you contracted this and then you contracted another version down the line, if you somehow haven't by this point, you're going to be in a fucking better state. So it's just fucking weird that they keep wanting to start so much rivalry between the vaccinated and the anti-vaccinated. Oh, it's an inconvenience for me to manage 1,000 troops, and oh, look, the numbers are higher, so it's got to be worse, even though the number of deaths has actually gone down. It's just, I don't know who. Yeah, we do. Laura A. Biscoff from the Akron Beacon Journal gave this lovely article. Simply amazing. I love it. Yeah, it's man, some of these comments on here are just insane. There's just so much animosity, and articles like this are programmed or are designed specifically to program that animosity by the terms that they use. They scare people with the high case counts, with the positivity rates, which that is a net positive factor of detecting more no, not using testing kits on people that don't need it. That should be a natural state of affairs as you go through a pandemic. And they say it like it's supposed to be this number, like, oh yes, more people are contracting it, and they're always positive. It's getting, it's insane. Like, this stuff is so. And maybe in their defense, they may not intend for this stuff to come out this way. But when you read the comments of how people are responding to it, that's exactly how it comes off. Nothing short of. So that's the message that you're delivering, and it's your job to be responsible and make those changes if you are creating that and harboring that conflict among people. Yes, you should get the vaccine if you're comfortable with it, but I can also understand why a lot of people wouldn't be when you have articles like this being at the forefront of the whole situation. And just a lot of second doubts, second questions, constant variations, the, the different symptoms of different vaccines and stuff like that. Like, people have their reasons, not like full blown conspiracy, but people on an individual level have their reasons for whether they would get it or don't get it. And it's not your responsibility to uh, morally gatekeep and gaslight these people who maybe choose not to get it. That's all I got to say on this. I just found this article very interesting, real quick, but whew.